I first noticed gynecomastia in my early 20s. In researching the gynecomastia, I found that there was a genetic component, and certainly looking back at my own family tree, there was a genetic component, a predisposition to have gynecomastia. There are also things you can take, exogenous substances you can take that tend to predispose you to such, that I found as well. As far as my day-to-day life, it affected mostly how I felt about myself as well as what I wore. From various, whether it's a shirt or a sweater or something I wanted to wear, it certainly affected my day-to-day life. Early on, when I first noticed having the gynecomastia in my 20s, I tried diet, exercise, over-the-counter supplements, and it wasn't until later on when I went to medical school and became a physician myself and understood the principle behind gynecomastia being that it's glandular tissue, not something that can just kind of come and go like a body part that you can shape in a gym. It's something that actually has to be removed. The best and only way to actually do that is to find the right surgeon and the right surgical technique in order to remove that glandular tissue. Gynecomastia affects all age groups and all body types. I mean, I wrestled in college. I've always been in really, really good shape my entire life. And my way of compensating for the gynecomastia I had was by overbuilding my muscles. And I tended to do that because I had a really hard time accepting the fact that maybe this was gynecomastia, and I just wasn't educated enough on what caused it and how you fixed it. And coming from somebody that really has a hard time accepting a flaw or spent so much time trying to stay in such good shape and stay healthy, it can be very devastating. And it's a simple, simple fix. So it took over 10 years to finally decide to have this procedure done. Knowing this is the only way to fix it, I narrowed it down to really a handful of people. And this is from both research personally on the web and talking to individuals, and as a physician, talking to other physicians in the community, other plastic surgeons that I know, and found that Dr. Cruz is among the top rated surgeons in the United States for a couple of reasons. One, just the number of cases that he sees. The results are just absolutely profound.
We are so grateful for the results from the procedure with Dr. Cruz. I already knew that I was exceptionally lucky when I met my husband, but now his full potential is truly shining. We both try really hard to keep ourselves in shape and stay fit for not only ourselves, but for our young family. And there was just some results that just weren't able to be done, with gym and exercise and eating healthy.
Looking back, I would have done it sooner. If I would have known what I know now, especially somebody that's in their teenage years or early 20s, I'd encourage them to get it done. It makes such a profound difference in their day-to-day life. It can make such a profound difference in how they feel and how they express themselves and interact, just in life in general. So the biggest advice I can give to anybody is to go ahead and get it done. Don't wait.